I've had a lot of male nurses save my butt before
Mm-hmm.
in crisis situations because when you're a nurse and it's just logistics, most nurses are women.
Mm-hmm.
Mo-
Large majority.
the large majority of nurses are women, and when you have a patient, let's just put a perfect scenario in place because this actually did happen. Um, Psych patients, when they are not medically well, have to go to a hospital to be treated, to be
Mm-hmm.
stabilized, to go back to the psych hospital or wherever they were living. So, say they ingest a light bulb, which this actually happened. So, this is the scenario I'm given without giving too much details. The patient ate a light bulb and had to come to us to get medically cleared from the injuries he, did to himself. And during the middle of this, he's actually being treated for a mental health issue, a serious mental health issue with a tendency of violence at a mental health facility. This dude is 350 pounds and about 6'5" with a
Oh,
tendency for violence, serious violence on a unit with all female staff. So when he code grays, which in most hospital is like a behavioral code,
yeah.
right?
Yeah.
When we call the code gray, there's a male nurse that came to help us who physically intervened in front of the female nurses. That's a scary situation. When you talk about safety, right? The resources in every facility that I've personally been in have not been what they should have been, could have been, would have been for nurse staff safety. Only one hospital that I've ever worked at, and I worked at downtown Dallas at a level 1 trauma center. Only one hospital I've ever worked at had a metal detector when you walk in the door. One of my friends right now, um, she works in PA, and she had a nurse stabbed in the parking garage leaving work. I've never had a security officer stationed in the parking garage. Not even when I worked in the bad parts of Memphis.